So, how does this scheme align with India's long-term goals for healthcare accessibility and affordability?
Okay, Drishti, this is a scheme
Yeah.
which is a very strong, like a big important pillar for
Yeah.
universal health coverage. What is universal health coverage? Universal health coverage is that we should have quality services available, and different kind of quality services available, and they should be affordable.
Mm.
Okay, so one aspect is that they should be hospitals, doctors, paramedical nurses who are very well trained, and they should be systems for providing services. And in using those services, people should not become poor. Then the services should be affordable.
Mm.
So there are two parts, right? Providing services and making them affordable. So this scheme makes the services affordable, right? Because what we are saying is that services are available in public sector and private sector, but some people can't afford them, so government will pay for them. So
Mm.
government is providing that affordability support. But other aspects of creating services, developing services, training doctors, establishing hospitals is still there, right?
Yeah.
So we have to fill those gaps. But this fills a huge gap that, currently in India, about 70% of services in tertiary care, where hospitalization is required, are provided by the private sector. So private sector has large capacity, but poor people can't go to private sector.
Yeah.
So this scheme helps them go to private sector and use the private sector services, which can be given to poor people. And almost every weekly basis, monthly basis, I come across a lot of people who have been helped by this scheme. They wouldn't have been able to either not use the services, or they would have become really, really poor,
Yeah.
and they feel that the scheme has helped them. So now you ask me the question that how does it fit into the overall plan for universal health coverage? It is a very important pillar. It helps poor people, and actually not so poor people, uh, uh, use the currently available services.
Mhm.
One more thing which is happening is that, the private sector, as you know, is largely in large cities, like you live in Mumbai,
Yeah.
no dearth of hospitals. But if you go to small city close to Mumbai, there'll not be any hospitals. And the reason is that private sector is not interested in going there, because people can't afford to use services, right?
Yeah.
Now with Ayushman Bharat, they can afford, because now government is paying for it. So now we are seeing that private sector actually is going to and opening, investing in small cities and small places, because they know that once they open the hospital, even the people living around there can help, can use those services. So I mentioned that, this scheme has been put in place to help people use the current services, but indirectly, this scheme is also helping in expanding services.
Yeah. So it's sort of like a win-win situation for
Yeah.
both parties.
Yes. Yes.
Yeah. Okay. So the next question is, what were some of the challenges that you faced while implementing the scheme?
Mm. So this is a huge amount of challenges.
Mhm.
Uh, if I start to when PM told me that I have to implement this scheme within 6 months. So the biggest challenge, or like I shouldn't say biggest challenge, first challenge was how to find people who can help me.
Yeah.
And of course, because unless we have people, I can't do anything. A single person can't implement a scheme like this, right? So finding the people, right people who could work with me in a team was a first challenge. Second was that convincing all the states to join the scheme. And so there were states which were ruled by BJP, and they didn't have any political problems. But there were other states which were not ruled by BJP. They had a non-BJP government, convincing them to join the scheme, and going and meeting with them, and trying to go like showing why joining the scheme makes sense for them, and will help the government and the people of that state. That was one challenge. Then, it's a very complex scheme. So putting all the pieces together, all the rules of the game, like what kind of services will be provided? Will we add outpatient services? Are we going to be adding what kind of inpatient services? Then making the rules about what kind of hospitals will be impaneled, how will we impanel the hospitals? Then creating an IT framework, right? Which will be and developing and implementing that IT framework so that uh, we can identify patients, whether they're eligible. We can also track the services which are being provided. That was a challenge. Then, there is a always a fear of or challenge of fraud and abuse, that, if the private hospitals, public hospitals are doing frauds, then
Mhm.
how do you ensure or catch them, and make sure that there is no fraud and abuse and leakages. So having a systems for doing that. And again, establishing these organizations at state and district level
Yeah.
to implement it, to training those people, and to make sure that they know what the systems are, creating a call center so that people can having a strong grievance redressal. So there are large number of challenges, Drishti, and for first 6 months I was working. Probably we didn't have any Saturdays, Sundays. We didn't have any Holi or Diwali. We were working through uh, every day, 14 hours a day for 6 months at a stretch.
Yeah. So now, so you've left the scheme in a very short period. I think 3 years.
Mm.
Like it was 3 years in when you left the scheme. So now it is such a huge project, as you've said. So were you able to see some initial success in the small period that you were there?
Absolutely, absolutely. Even when I was there, we had celebration of first 10 lakh people who were given treatment, then one first crore people who were given treatment. And even when I was there, now we are actually having 20 lakhs treatment every month. At that time, it was 7 to 8 lakh treatment every month. And in a short 3 years period, uh, we could see a huge amount of impact in terms of coverage of the scheme, knowledge of the scheme, and the impact it was having. Um, then there have been some studies also done, which are done by academicians and students, and that also show a few things. One, that out-of-pocket expenditure, the people who are using them, they are saving a lot of money. They are not spending money from their pocket. The rate of impoverishment has gone down because of the scheme. A lot of people, it's provided safety net for people
Yeah.
in terms of uh, not getting impoverished. Also, it is showing that people are coming to the treatment early. Uh, you know, um, what happens when you're not covered by any scheme and you have to pay yourself? There's a tendency that you delay the treatment, right? Because
Yeah.
you think that this is going to go away on your own, because and also you uh, fear going to hospital because you don't know what is will happen. They'll be asking for many diagnostics, and there'll be the large amount of expenditure, and so they uh, delay the treatment. They either don't go for treatment, or if they go, they delay it. And
Yeah.
the delaying treatment actually makes the disease even more complicated. So there was a study recently which has been published in Lancet, which is one of the major health journals in the world, which shows very clearly that people who are covered under Ayushman Bharat PMJ,
Mhm.
they're coming for treatment for cancer much earlier as compared to those who are not covered.
Mhm.
So if you have cancer, it's much easier to treat, and it's more effective. The treatment is more effective. It is treated early. And when it takes root, it's much more difficult. And I think in some cases not possible to treat. So the fact that people with cancer are coming early for treatment, I think also is a big achievement
It is.
of the scheme. So I feel actually very gratified that this scheme is having real impact,
Mm.
not only in terms of number of people it's covering, but also the lives it's saving, and uh, saving a lot of families from falling into poverty.
Yeah.